We're joined on the phone lines now by Paul Seegert. He is managing partner at PCS Advisors, a health benefits consulting firm, 35 partner offices across the nation. PCSadvisors.com is the website. Paul, thanks for jumping on with us here on the Steve Gruber Show.
Good morning.
Seeing headlines about this new batch of hyper-expensive drugs. You have these medicines that are priced in the millions of dollars each patient, which is an incredibly high amount. I don't have to say that. What are these? What are the benefits? What are these medications all about?
Well, many of these are what's called orphan drugs, where we created some rules in our system 30 years ago-ish, where we would create tax incentives and give extra longer exclusivity periods and so on. Just gave incentives to manufacturers to create drugs that would treat small populations of people, so very rare diseases, typically affecting less than 200,000 people in this country. And you could look at this and say that it hadn't had exactly the desired outcome. We've got 4 drugs just since August that have been released and approved that are north of $2 million per patient per drug. Hemgenics being a really amazing example, $3.5 million for a drug that will treat people with hemophilia. Just really incredible cost.
So how do those drugs and those medications then begin to work their way into the system? Because individuals aren't paying most individuals aren't going to pay millions of dollars up front for these medications. And I don't even know if the healthcare system, the health insurance system, is set up to handle drugs like this. Who qualifies? How are they covered? How are these things actually paid for?
Well, that's what we're going to find out here as we go forward. This is going to be another test to the system. We have, I think, the best healthcare in the world happens here. People come from all over the world to get treated here for diseases and so on. But we really need to do a better job of how we pay for it. And this is going to be a test to that. It's going to have to get baked in some way to the premiums that we all pay for health insurance, which obviously means, yet again, costs will go up. And it makes me look at the fact that, or think about the fact that we as American consumers fund so much of global profits for what we all call big pharma. Depending on whose analysis you believe, it's somewhere around 80% of global profits are made by selling drugs to our consumers here in this country. And so, I think we're going to look at this and say, yet again, people all around the world are going to get access to some amazing and expensive drugs, largely because of the fact that our consumers here pay the highest price.
Talking with Paul Seegert, managing partner at PCS Advisors. You can find out more at PCSadvisors.com. A lot of these treatments, Paul, are essentially single treatment, single time treatments, supposed to sort of ongoing medications, ongoing treatments, every other year, every 5 years, or monthly prescriptions. Does that also change the way, or should it change the way that health insurance companies look at these treatments, that at their one-time cost as opposed to ongoing costs for many customers across the country?
Yeah, they will consider that. I think in many cases, it definitely goes into the underwriting process and the math behind the scenes. If you look at something and you're able to solve it in one shot for a certain amount versus chronic ongoing treatments, that there can be a good ROI on that. And I think in the past, it's just simply been easier to swallow or easy to incorporate into our system because it wasn't such a big hit all at once. It was very rare. You go back 5, 6, 7 years ago, and prior to that, you wouldn't have seen a drug come to market that was above 6 figures. It was very, very uncommon. They just wouldn't price them there. They didn't figure that would fly, and that the system would even tolerate it. But I think we're also dealing with an unintended consequence of this Affordable Care Act era of healthcare, where we really took the price cap off the top of the system. And I know it was well intended when we came and said, hey, there will be no lifetime maximums on your insurance plan. Everything will be covered. But you can see how that might be good on the one hand and create some negative outcomes on the other. If you tell the people that sell you all this stuff, hey, you can charge anything and the insurance will have to cover it. I think that kind of contributed to this.
Paul Seegert's been studying these things for years now, health benefits, and are there easy ways? Are there simple ways to change, to adjust what we're doing now that benefits both the employer and the employees when it comes to health insurance and health coverage through employers?
Well, it's become a massive problem for employers, and we're watching it. You can see it in the way that more and more people are shifting into government programs. We crossed a line in this year where we have more than 50%, through the COVID era, more than 50% of us now get our health coverage from the government in some form. 51%, 49% now get it at work. Used to be 20 years ago, 2 out of 3 of us got our coverage at work. That was really important to the funding of the overall system because hospitals and other providers of health care services made their profit margin on those commercial payers, those employer plans, and they broke even or lost money on the government payers when they showed up. And so you have small employers that each year, less and less of them, when they do the math, can really budget it, or they look at it and say, why should I continue to offer benefits when my people could go to the exchange and get a subsidy? And so we've created this I think, unsustainable path that we're on, and it definitely needs to get addressed. Employers are having a tougher and tougher time. And when it's true to say that Starbucks spends more on healthcare than coffee beans, you might have a problem.
I suppose that's true, indeed. Talking with Paul Seegert, he is managing partner at PCS Advisor, a health benefits consulting firm, 35 partner offices across the nation. You can find out more about Paul and PCS at pcsadvisors.com. Hey, Paul, thanks so much for jumping on this morning with us on the Steve Gruber Show.
Thanks for having me.
I appreciate it. That's Paul Seegert.